Good afternoon, everyone, and thank you for joining today's press briefing. Today, we'll hear from Mayor Tom Barrett, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Director of Medical Services with the Milwaukee County Office of Emergency Management, Darren Rausch, Health Officer and Director with the Greenfield Health Department, and Bishop R.J. Burt with Greater New Birth Church. Thank you all for being here, and Mayor Barrett, I'll hand it over to you to get it started.
Thank you very much, Catherine, and good afternoon, everyone. Well, a lot of activity is occurring this week, and I'm very, very pleased to say that we are certainly at the point now where we are full throttle. We have the site at the Wisconsin Center. We have the sites at North Division, the site at South Division. We're going to have a site at the Northwest Health Center that I'll talk about in a few minutes. We've got many community sites. And as we just heard, President Biden continues to make this a priority for his administration. And so I think the message is get vaccinated. Get vaccinated. The opportunities will be there as we get a larger and larger supply. So we continue to have a lot of activity at the Wisconsin Center. In fact, my wife was there yesterday. My wife's an educator. She got her second shot. She had a 4:10 appointment, and she said she was out of there by 4:41. So 31 minutes, which included the 15 minutes to sit after you've gotten the shot. So you can see how efficient things are going. And we're very thankful to our partners for the work we're doing at the Wisconsin Center. That, of course, has allowed us to move into the community, which has been one of our concerns all along, to make sure that everyone from our community has access to these vaccinations. So we will continue, and we are continuing to vaccinate individuals from our top 10 priority zip codes at both North Division and South Division community sites from 10 a.m. to 4 p.m. Monday through Friday. No appointment is needed. In fact, I was at the South Division site less than 45 minutes ago, and I can tell you, just to give you a tip, probably the best time to go if you don't want to wait is between roughly 11 a.m. and I'd say 2:30 to 3 o'clock. There was virtually no line when I was there 45 minutes ago. And so again, we know that there is capacity there. In fact, if anything, we have the capacity and we don't have the demand, both at that site and at the North Division site. And that's a concern. We want people to use these sites. This week, we vaccinated a total of 1,384 people at South Division and 1,069 people at North Division High School. And we can do many more. So we continue to have capacity at these sites and want to encourage eligible community members to get vaccinated. I want to remind people that these vaccinations are free. No clinic or vaccine distributor will charge you to receive a vaccination. We also have had tremendous success working with our community partners. And I'm pleased to share that Bishop Burt from Greater New Birth Church will be joining us on today's briefing a little bit later to share his experience partnering with the health department to vaccinate nearly 800 people at his church last Friday. And I was there also. Again, it was great to see so many people from the neighborhood taking advantage of that. So I want to thank Bishop Burt ahead of time for his partnership. His team was just phenomenal to work with. So looking to the future, we will continue to expand community sites. Starting Monday, March 29th, our Northwest Health Center walk-in clinic will open at 6431 North 76th Street, with the same hours as our other no appointment clinics, which is 10 a.m. to 4 p.m. Monday through Friday. In addition, we've had great success partnering with organizations like Northwestern Mutual, which once again is a great corporate partner. And they've been working with the Dominican Center, the Metcalf Park Community Bridges. And next week, there will be 2 vaccination clinics available in the Amani and Metcalf Park neighborhoods for residents 16 and older. So a big shout out to Northwestern Mutual for its continuing partnership. In addition to that, a site at COA Youth and Family Center located at 2320 West Burleigh will host its clinics on select Saturdays from 9 a.m. to 1 p.m. beginning this Saturday, March 27th. Also, a site at the Wisconsin Black Historical Society located at 2626 West Center will open Wednesday, March 31st from 9 to 1 p.m. And we will continue vaccinations on select Saturdays. So for a schedule of full hours of operations for these sites, or to ask additional questions, please call 414-444-9930. I'd like to switch gears for a moment to talk about the American Rescue Plan and the impact it will have on our city. We know already it's having a very positive impact on our residents, those individuals who got their stimulus checks, those individuals who are now eligible for expanded earned income tax credit, those individuals who will get an additional child tax credit, and those individuals who will have the ability to sign up for the Affordable Care Act, which has been expanded, and the president has moved forward to make that more easily accessible as well. But the money available for local initiatives through the plan is unlike any previous federal program. It is extraordinary, and it gives us a chance to improve lives, to solve problems, and profoundly improve upon city government in helping to address local challenges. One thing is certain, and that is we want to make sure that we're filling the hole that was created last year by the COVID-19 pandemic. So I've been working with the budget office. I've been talking to members of the Common Council about my desire to make sure that those fiscal shortfalls that we had last year, that we are replenishing those and filling in those holes before we look at the remainder of this program, the funding, which is very, very plentiful. But my priorities are clear. With this money, I want to increase housing options, economic growth, and employment opportunities for all of our residents. I also want to make certain the city's racial equity and inclusion goals are met and exceeded and improve our public infrastructure. Specifically, a couple of things that I think are worth really digging into here are accelerating my 10,000 homes initiative, increasing eviction prevention and lead abatement efforts, expanding access to high quality early childhood education, growing employment, especially in and around the central city and places like Century City. One of the issues that really came to the forefront for me during the last year has been equitable internet access. And so working both with community providers and with the for-profit companies for expanding broadband is very high on my list. We want to accelerate work on water, sewer, and other key infrastructure systems because we know that that has had a negative impact on some neighborhoods in the city. But we also know that all this undergirds our desire to focus on pandemic recovery and resilience programs, especially for local businesses and the small businesses that were hit so hard over the last year. And finally, we're going to be looking to expand our streetcar system to extend into neighborhoods, building upon the current economic impact we've seen along the route and the expectation that transportation bills will be coming through Congress will allow us to do that as well. To be sure that these dollars positively impact everyone, we are going to be including residents in the planning process. We will coordinate with other agencies, with the Common Council, and we want to be held accountable in the efforts that we undertake. Finally, I want to provide an update on our COVID-19 community testing numbers, because again, I think, and Dr. Weston will share this, unfortunately, we're beginning to see the numbers head in the wrong direction. And we've seen now the greatest number of people tested at Miller Park yesterday in the last 2 weeks, 499 people were tested actually at American Family Field. That's the highest we've had in the last several weeks. The Northwest Health Center had 98, the South Side Health Center had 71. As Dr. Weston shared on Tuesday's briefing, we continue to see a rise in positive cases in our city and our country. So that's why testing remains as important as ever to detect these increases and capture the true rate of disease in our community. We use our testing data to guide our decision-making and keep residents safe. In order to make the best decisions, we need to have robust testing. So please continue to seek testing if you are experiencing symptoms or think that you may have been exposed to someone who has tested positive for COVID-19. So with that, I'm going to turn it back over to you, Catherine. Thank you all very much.
Thank you, Mayor Barrett. And now we'll hear from Dr. Ben Weston.
Thank you, Catherine. Good afternoon. First to our numbers, we are currently seeing an average of 86 new cases a day in the county and about 2 deaths every 3 days. We see stable week-over-week vaccination rates, just under 7,000 vaccinations per day on average. We continue to see a concerning rise in numbers of cases in Milwaukee County. For the first time today since January 11th, we're changing our key indicator for cases to red as a measure of concern. And this means that we've had a 14-day significantly positive trend in our number of cases. Additionally, our percent positivity is rising, up 1% since last week. These are only 2 indicators and only 2 weeks of data. However, it's in the context of a rise in cases at the state level, similar to many states around the country, as well as a national rise in cases and a rise in hospitalizations in some states, particularly in neighboring Michigan. The warning lights are blinking and we need to be cautious. We can certainly hope that our rates of vaccination and continued vigilance can blunt an incoming increase. However, we're fighting against a new strain with increased contagiousness and very likely increased severity. Despite dealing with this pandemic for a year at this point, we're entering new and unknown territory. The combination of the vaccine as well as the new strains make this a very difficult situation to predict. What we do know is that the best thing everyone can do is wear a mask, keep your distance, and get vaccinated. On the last front, we continue to work aggressively to vaccinate our vulnerable populations. Due to the surge in interest, zip code appointments filled up pretty quickly. And that said, now, in addition to our Moderna, we'll also be offering Johnson & Johnson at our county site at Kosciuszko Community Center. This will open up more appointments for our zip code program and also allows us unique opportunity to reach out to hard to reach populations. So for anyone over the age of 16 in our target zip codes, over the age of 18 for our site in our target zip codes, please go to covidmke.com to sign up for the vaccine. And for anyone in those zip codes or who meet state eligibility for vaccine, you can now go to healthymke.com to see a brand new vaccine finder tool where you can enter your zip code and see vaccine sites that are available to you. Additionally, I've heard people concerned about the BMI category, whether a BMI of 25 really means that you're overweight. BMI is far from a perfect tool. My sister Elizabeth is a personal trainer in River West, and I think that she said it best. If your BMI is 25 and over, certainly get vaccinated, but don't let your BMI define your health. People can have a high BMI due to fat, but also due to muscle. Regardless, it's one of many eligibility criteria that can connect you with a vaccine and get you protected. That's to say, in short, if you're eligible, get vaccinated. Try out the new vaccine finder tool at healthymke.com and keep up your vigilance with personal precautions. We'll know in the coming weeks if these warning lights that we're seeing will amount to a blip or a spike. Either way, better times are coming and they're coming soon. In the meantime, be safe and be careful. Thank you, and I'll hand it to Health Officer Roush.
Thank you very much, Dr. Weston. Very good points as always, and they really dovetail into what I want to talk to you today as well. Before we jump into the data, I just want to hit some of those overarching themes, and Dr. Weston hit them well. We are, for the first time, after 10 consecutive weeks of either decreasing or plateauing numbers, we're starting to see evidence of an increase in cases. And this is really the first time this year since the first week of January that we've seen an increase in cases. This increase is seen not only in the population-based cases for the whole county, but also for our kids as well. And we'll look at those data a little bit more in a little bit. What's important to know is that we need to continue to watch this data closely over the next week to determine whether this is a trend or whether it's a blip in the data and in the case trajectory. The change in case trajectory could be due to small numbers because we are at a much lower rate of disease than we have been in the past. But alternatively, and more concerningly, the data could be reflective of increasing transmission and could be the start of another peak. And we just quite frankly don't have that data right now. So at this point, I would call the peak concerning, but not yet alarming. And in either event, we need to make sure that we're continuing to maintain vigilance on the 3 W's, the wearing the mask, watching your distance, and washing your hands. And even more importantly, as eligibility has expanded for COVID-19 vaccine, getting your vaccine when you become eligible. So let me take a moment here and pull up some of the new data just to kind of show you where we are and a couple of the things that are concerning this week, and we'll certainly be monitoring these very closely in the coming weeks. So what's on the screen before you is the incidence of new cases daily in Milwaukee County. And really what we're looking at here is this tiny upward reflection on both the orange and the blue lines, which are the 7-day averages for Milwaukee County suburbs in blue and the city of Milwaukee in orange. And more importantly, we see that this data that we always label as provisional data or draft data or pending data, we certainly see that there's evidence of more cases to come as we envision mapping this out over the next several days. I'll show you the kids report similarly. The kids report is very similar. A lot of cases are pending, but that's certainly going to drive those averages up. I'll just note that in the kids data, we're looking at this line here being 10, this line being 20. So there's a lot more fluctuation in small numbers. But anecdotally, I can tell you, and colleagues across the region can say, we have seen more cases in schools. Granted, that might be, 1 case to 3 cases or 2 cases to 5 cases in certain schools, but certainly we have seen more cases and thus more quarantined individuals in school settings more recently. So moving back to the county-wide data, as we look at deaths, again, the deaths is a lagging indicator, but it's also something that we've seen tail off pretty considerably since mid-February. And I would attribute a lot of that to high vaccination rates and growing rates of vaccination in our older adult populations who are the most vulnerable and who have succumbed to more deaths and more hospitalizations over the past year of the pandemic. We've talked about growth rate and the reproductive number in the past, and sadly, I have to say that we have reached a kind of a new high for the last year. Our transmission rate is approaching 1.25 countywide, and that means for every 1 case of COVID, there is 1.25 additional cases coming from that initial case. So again, we need to squelch this transmission and we need to push that number below 1, and we need to use those mitigation strategies, our masks, our distance, and more recently vaccination to move that number down. When we compare this data for the city of Milwaukee on the top and the suburban communities on the bottom, we see that the number is higher in the city of Milwaukee currently than it is in the suburban communities. And again, we want to push that number down, not only in the city, but certainly in the suburban communities as well. Demographic patterns and the keys to both hospitalizations, deaths, and cases are very consistent and haven't changed significantly in the most recent weeks. We talked a lot about testing, and testing availability certainly exists throughout the county. We've seen some slight decreases, but certainly there's a lot of capacity still remaining. And as Dr. Weston mentioned earlier, that 14-day trend is positive in the wrong direction. We don't want it to be increasing. We want this to be decreasing. So it's another trend that we'll be monitoring in more recent days, including the daily percent positivity numbers as well. Lastly, I'll just give you a look at where we have had cases over the last week, just reflecting the spatial distribution of COVID-19 in our county. The areas that are red and orange are the areas where we've had higher incidence, and this number has inched up just a little bit more over the last week than we have seen in the past. So while our cases have been down and while our cases might be inching up, we need to continue to remain vigilant. The last topic I want to talk about today is just really considerations and thoughts and information to share about both spring break and the upcoming religious holidays of Easter and Passover. As I've mentioned, as Dr. Weston has mentioned, as Mayor Barrett has mentioned, we need to continue to remain vigilant. And I know this is a story that you hear us say over and over again, but this does mean the 3 W's, and it does mean continuing to be cautious and taking those precautions. If we're truly at the start of an increase, we need to double down on those precautions and be extra vigilant. It also means getting vaccinated. But for those of you who are contemplating either spring break travel or hosting family gatherings, be sure to be cognizant of what's happening in and around the community. If you're traveling, COVID-19 is widespread in certain parts of the United States, much higher than it is here in Milwaukee County. And certainly we know COVID is a global issue as well. We also know that COVID variants exist at much higher levels in other states and in other countries. And we need to keep all of those things in mind. The act of traveling itself doesn't necessarily increase your risk, but most often the types of things you do while you're traveling do put you at risk. If you live in the Milwaukee area and you're being safe and you're staying at home, and you now travel to Miami and you're going to spend time on the beach and go outdoor to dining and go to bars and restaurants and other, higher risk events, that's going to put you at greater risk. So remember, if you're traveling, the things that keep you safe in Milwaukee are going to be the same things that keep you safe wherever you may be traveling. That vigilance that you follow at home is even more important to continue to follow while traveling, whether you're traveling by car or by plane. Similarly, if you're planning a holiday gathering over the next couple weeks, remember to keep your options open and consider the options to keep yourself, your family members, your loved ones, and friends safe. With increasing vaccination status in our communities, we know that there are people in our families that will be safe to be around or safer to be around. But yet we have to be cognizant that not everybody is vaccinated yet. So the 3 W's and other methods of mitigation and vigilance are going to be important. Perhaps your Easter or Passover holiday has an outdoor flavor to it this year, because outdoor is a safer environment overall. So I'm certain we'll talk about this in the coming week as well on media briefings, but if you're planning ahead, think about safe ways to deliver family gatherings for the upcoming religious holidays. Thank you very much for your time and attention today. I'll now turn the briefing over to Bishop Burt from the Greater New Birth Church.
Thank you so much. Welcome to all of you all. Thank you for having me. I wanted to just take a moment to talk about the experience that we had here at Greater New Birth Church on last Friday, as we were a vaccine site for the city of Milwaukee in partnership with the health department, Ms. Kirsten Johnson and Nick Tomorrow. And we partnered with Milwaukee Medical Health Services, which is on the northeast corner of Fond du Lac and Silver Spring, and we are on the southwest corner of Fond du Lac and Silver Spring. What a great event it was. I certainly have a personal interest in vaccinations as it relates to COVID-19, being that I am a COVID-19 survivor who also suffered some long haul effects of having suffered with COVID-19. So we did partner. It was a great event. I want to thank our mayor in the city of Milwaukee. The mayor has shown a great interest. I had a conversation with him earlier in the year about areas that perhaps were underserved or challenged. And through that conversation, waited for action. And he certainly put, if you will, the vaccine where his mouth was. And so I do want to thank Mayor Barrett for just following through on that, along with Ms. Marcy Patterson, who is our liaison with his office. We were able to serve, as the mayor said, almost 800 people in one day. I think it was about 6.5 hours, perhaps. Just a very well-oiled process with the city of Milwaukee. Greater New Birth offered its site, and we certainly had some volunteers here, yet partnering with the city and the National Guard and others, Milwaukee Medical Health, we were able to come together and to collaborate and to make it just work so smoothly. I was so really blessed by it, being able to serve almost 800 people. And we are looking forward in the future to partnering again with all of the elements that we were together with to make things happen. COVID is no joke. We are coming up on the special time of year for churches, of course, with Easter coming and things like that. And we certainly are going to be cognizant, along with others, about making sure that we operate in a way that it will be safe for our community. I do want to just encourage our other leaders of ministries and civic sites or social sites to do whatever we can to make sure that our community gets vaccinated. to make sure that we are providing for a safe environment and to do our part in that. So if there are any other pastors from our community who would like to call me, you certainly can reach me at Greater New Birth Church and call me so that we can talk and perhaps even strategize, to turn that number some way into collectively, 5,000 people in one day being vaccinated in our community. I know that we can, and I believe that we will. So again, I want to thank you for allowing Greater New Birth to be a part of such an audacious effort that proved to be so beneficial for our community. People who had already been vaccinated but knew me and perhaps didn't know me from the church realm, but saw the TV, the news feeds were calling saying, hey, thank you for your church being involved, and thank you for the work that you were doing. I heard people talking about the benefit of having had this done. I saw one lady was in line and they were saying, you're here to be vaccinated. She said, yes, basically my worries are over. I can get this done. And so just to hear people talk, it was so great. Again, thank you for allowing us to be a part of what happened. And we look forward to working with you guys again. With that, I'm going to turn it back over to Ms. Catherine Foley, and she can take us further.
Thank you, Bishop Burt, and thank you for your partnership and collaboration. We really appreciate it. We'll now move into the media Q&A portion of our briefing. And our first question comes from Nick Bohr with WISN 12, and it's for the mayor and Bishop Burt. There's two questions. Mayor, you mentioned turnout at North Division especially isn't what it could be. We're seeing it declining each of the 3 days it's been open so far. What can be done to increase awareness of the walk-in clinic and perhaps, given the numbers, increase demand? And then the second portion is for perhaps Bishop Burt, if you're open to commenting about what you're hearing could be hesitancy in getting the vaccine.
Well, I'm going to keep beating the drum as loudly as I can for all the sites. I think it's really, really important for people to get the vaccination. And I think what people are seeing right now is just how incredibly committed we are, both the city and the county, to get as many vaccinations into people's arms as we can. So we are going to continue to go forth and multiply. If I can steal a phrase that might be used in Bishop Burt's church, we're going to continue to go forth and multiply these vaccination sites, because we know that we have racial disparities in this community as it pertains to healthcare, and we don't want to see that have a negative impact on people. But make no mistake about it, I want everybody to get vaccinated. That's what I want. That's my goal. And we're putting this special effort in because we know the disparities are there. But that's why I led off with Wisconsin Center, still a very, very, very viable place. And you're going to see this, supply continue to grow. But right now, particularly in these community sites, and I figured this was going to happen. The first couple of days, you have the people who were chomping at the bit to get the shots. Now it's sort of coming down a little bit. And so if you were someone who was not chomping at the bit, but still want to get the shot, as I said earlier in this broadcast, when I was over at South Division at approximately 20 to 2 today, they were telling me, tell people to come, and that this is a great time of the day to come, between basically 10:30, 11 in the morning and before 3:30 when people are getting off work. So if you're watching this and you want to get that shot and you live in those areas, please take advantage of this.
And Bishop Burt, not sure if you have any additional commentary as what you're hearing from your community related to the vaccine.
Well, I think it helps in our community, accessibility, but also education. Of course, our community has had bad experience with vaccinations or with medical work in the past. And I think sometimes negative talk impacts that, but knowing people who have had the vaccine and who feel good about the vaccine, so people touching people, I think is going to be crucial and important. I know on the day we had the vaccine, I personally made a number of calls and to a person, the people I talked to who were not going to get vaccinated, they all came to get vaccinated. Some may say, well, that's because you're a pastor, but I don't believe so. I think that education and then also people just knowing people and spreading it like that. But accessibility is also very important. And our community is very spread out in the city of Milwaukee. And I think as we can get this in more places, get the word out, have people touching people, I think it will make a great impact.
Thank you, Bishop Burt. Our next question comes from Tom Durian with TMJ4. He says, Mr. Mayor, on the Northwestern Mutual sites in the Amani and Metcalf Park neighborhoods, these areas showed high level of disease during our COVID peaks. Why weren't these neighborhoods included in the zip code program?
I'll maybe jump on this one quick, and Mr. Mayor, obviously welcome to expand. So the initial 10 zip codes were determined based on the CDC's Social Vulnerability Index. And so this was using methodology from the CDC as well as the US Department of Housing and Urban Development to determine what were the 10 most vulnerable zip codes in the county. So absolutely, no process is going to be perfect. However, we certainly hope to expand to more zip codes in the future.
And of course, Dr. Weston absolutely nailed the reasoning behind that. But I think what you're seeing here is an attempt, and again, I'll shout out Northwestern Mutual. They have longstanding relationships in Amani and Metcalf Park neighborhoods. And I think that they wanted to use their goodwill, if you will, to work in those specific neighborhoods. So I'm very thankful that we're able to expand because of their generosity.
Thank you both. We have two more questions. Our next two questions are from Joyce Garbasiak with WISN 12. The first question is, Director Rausch talked about seeing more cases in schools recently. Mayor Barrett, does this temper your desire to have MPS return to in-person learning? And how do you respond to the union's concerns that the return plan is a mess?
Well, whenever I see any increase in numbers, I'm very concerned. I'm concerned about every single aspect of it. Not just education, but religious gatherings and public gatherings and restaurants. So I think anybody who has followed this for the last year and has watched these numbers has to be concerned when we start seeing these numbers increase. At the same time, I also recognize that every other school district in the state of Wisconsin has created either a program for all students to come back or a program for some students to come back. And I think it's important here in the city of Milwaukee that the superintendent work with the union, work with the educators to make sure that there is that option. But that doesn't mean that you would throw out the window all the safety concerns. Those are paramount to me. Those are absolutely paramount. And in terms of it being a mess, my wife is a teacher. She teaches 5th grade in Wauwatosa. And I can tell you that doing this is not easy. It's a challenge. It's a challenge when you've got some virtual. It's a challenge when you've got some kids who are in class. This is not an easy function at all. And clearly there's a lot of, I think, responsibility, and I think there's a lot of pressures on the Milwaukee Public Schools to get it right. But again, I think that it makes sense for us to try to have, for those families who want to have their children in school, to allow them to have the same option that every other child in the state of Wisconsin has. That's what I'm concerned about. But I'm very sensitive, again, to the concerns that are being raised by the union. And that's why, as I've said many, many times, we've moved heaven and earth to make sure that all employees of the Milwaukee Public School System would be able to get not only a vaccination, but 2 vaccinations plus the recovery period before the program starts. And we went a step further by reserving some of the Johnson & Johnson vaccines for those employees who work for the Milwaukee Public Schools who did not take advantage of this window, but could still today, tomorrow, next week, can still go in, get a Johnson & Johnson vaccination because it's a one-shot only, have the 10 or 14-day recovery period, and they'll still be ready for the April 14th opening. But again, there is a tremendous amount of work to be done between now and then because you've got busing issues, and that was certainly an issue in the school board meeting. There's childcare issues for the teachers, for the other employees, for the parents. This is going to be a very challenging, I think, a challenging period for everybody involved.
The second question from Joyce is for our health officials. She asks, is there any one event that can be linked to the jumping cases, St. Patrick's Day celebrations, allowing increased capacity at bars and restaurants? Is this enough of a jump to make health officials consider pulling back on capacity orders?
So I can certainly comment on the first part. It's always hard to tie a single event to a rise in cases. Now, that said, I think there's two elements that are factoring into the rise that we're seeing right now. One is the natural rise and fall that we've seen with COVID since the beginning, a year ago. We've had peaks in May, in July, and most recently in November. And each peak is preceded by a low period. And in that low period, because of not as much disease, because of not as much discussion of COVID, the vigilance loosens up and people go out more and institutions pull back, and throughout the country, states and counties and cities pull back on precautions, and then cases rise. And then once they get high, all of that flips and everybody's more careful and tightens back up and it goes down. So we've been in a low period, which is great. We've been in that for a while, but it looks like that is coming to an end, probably for the same reason that every other low period we've seen throughout the pandemic comes to an end as cases start rising. Now, the other item that is certainly leading to rising cases now is the spreading of the variants, in particular the B.1.1.7 variant, which is just so much more contagious. And so what used to have been a slight rise could potentially be a much steeper rise. So I think those are the two factors that are influencing this rise more than anything else.
Yeah, Dr. Weston is absolutely correct. And the only thing I would add, because the second part of that question was about health department orders and advice. I think right now we're going to continue to remain in a wait and see approach, but certainly the Milwaukee Health Department and others of us have said at any time we may have to go back to more restrictive measures based on the data. So as I've said earlier, I would call this, concerning. Not quite alarming yet, and we're in a watch and see, wait and see kind of period here over the next several days to a week, and we'll look at this. There has been, as I look at the cases on my screen before me here, there has been some variability. We've had little peaks for a week or two. We've come back down, but we've also had very large peaks and case growth. So we need to look at that carefully. I think it's too soon and too premature to look at making more restrictions, but certainly want to point out to all of those listening to this briefing and all of those throughout the community that cases are starting to inch up. And because we can use that data and we can do education and outreach like this, it's important for everybody to be aware of that.
Thank you both. Our next question is for our health officials on the call, and it's from Cassidy Williams with Fox 6. She says, a Milwaukee vaccination site tells us it is seeing no-show rates of 15% for the first and second dose appointments. What is the impact of no-shows on vaccinators, and what are your thoughts on the efficacy of just getting one dose?
Yeah, so let me start with the second part of the question about just getting one dose. We know we have three very good vaccines. We have Johnson & Johnson, Moderna, and Pfizer. Of those three vaccines, the Johnson & Johnson is a one-dose vaccine. The Pfizer and the Moderna are two-dose vaccines. I would say to anybody, get the vaccine that's available to you, because that's the vaccine that's right for you. But the thing is, with a two-dose vaccine, it is important to get both doses. The vaccine and the efficacy of the vaccine was tested with subjects and study participants getting both doses. So it's very important to get both doses. So if you get a first dose of Pfizer, 3 weeks later, you need a second dose. If you get a first dose of Moderna, 4 weeks later, you need that second dose. That is going to provide you full immunity. The Johnson & Johnson vaccine, on the other hand, is a one-dose vaccine. That's one trip to a clinic, one trip to a pharmacy, and you are protected. The second part of that question was looking at no-show rates. I happen to work the large clinic that Greenfield is operating in conjunction with our partners in the southwest corner of Milwaukee County. So we're working with Greendale, Hales Corners, Franklin, and Greenfield, as I mentioned, on Monday. No-shows have a pretty significant impact on scheduled appointment-based clinics. For that clinic on Monday, we had 480 or 490 clinic appointments, I believe, something like that. And for every no-show, it takes considerable balancing and and kind of that balance between how many doses do we use, how many doses do we not use, because we have scheduled for a certain amount of vaccine. And you've heard me say, and you've heard others say before, that we need to use a full vial, otherwise it goes to waste. So any no-shows, even 1 or 2, much less the 10 to 15% that the questioner asked about, has an impact on the clinic, because if I have 1 to 2 doses left, I need to try to use that as quickly and efficiently as I can so that dose doesn't go to waste. It needs to go into an arm to be effective. It doesn't need to go into the trash. So we work hard, no matter what rate of no-shows, to minimize any wasted doses. And we did, with about 12 or 15 no-shows on Monday at our clinic in this corner of Milwaukee County. We did find people to use those doses, and in cases where we didn't have to open a new vial, we didn't open that new vial. So no wastage at that clinic, but certainly it causes complications with the logistical nature of this vaccine.
Our next question is from Sari Lesk with the Milwaukee Business Journal, and perhaps Mayor Barrett, you're able to address this. She says, Northwestern Mutual announced it is working with the city to increase vaccine distribution and address disparities. What are other examples of businesses participating in local vaccination efforts, and what specifically are businesses bringing to the effort?
Well, obviously, the pharmacies have really stepped forward. The Hyatt Pharmacy, CVS, Walgreens have all stepped forward. So they've been good partners. The medical society and the medical systems, the medical college, all the hospital systems have been very, very good. And I think for most employers, it's giving the flexibility to their employees to get vaccinated. So as we have more partnerships, we'll be happy to showcase them. Not surprisingly, Northwestern Mutual was one of the first ones to step forward and say, we want to work with you. And we were eager to work with them. So we're very thankful, but we'd love to have even more partnerships. And if other organizations want to help us set up in different parts of the city, we'll do that. But we're also working, as you can tell from our friendship to Bishop Burt, we're also working with the faith community very closely also.
Our next question is from Jason Calvi with Fox 6. For any of those on our call, now that Waukesha County eliminated capacity limit recommendations, what impact do you think that decision could have on Milwaukee? Will it drive more business away from the city?
I don't think it will. I think what you're seeing right now, certainly in Milwaukee, is we continue, as we have been for over a year, to be guided by the science. We're going to continue to do that because we think that's the right thing to do. And we have seen the rates go up and down in different parts of the state. But I think that for all of us, business will be best when we are through this pandemic. And so that's what our focus is on right now.
Our next question is from Mayan Silver with WUWM. She is asking, is supply of vaccine keeping up with local demand?
Well, I'd say, we're very happy with the supply that we're getting. We're always happy to get more. We're reaching out to communities as quickly as we can. And more vaccine allows us to reach out more aggressively, reach into, more vulnerable populations and more aspects and areas of our county.
All right, the next question is from Sari Lesk with the Milwaukee Business Journal. She asks, what does contact tracing show about what's leading to increased spread? Is it related to specific business activities, small gatherings in homes?
Yeah, that's a good question. And I'll just go back to comments that I've made, historically in the past. Contact tracing is only as good as the information that we get when we do contact tracing. So I think many of you who are on these media briefings over the last year have heard me say and heard colleagues say that if we're not getting honest, forthright, transparent answers, we're not getting the information about where the source of the COVID disease may have come from. I would have to go back and look through those cases in my community. I know some of the causes, at least in my community, was large families where everybody comes down with COVID. And when you're dealing with small numbers, a family of 4 or 5 can make those numbers look bigger than they are. But contact tracing, even in March of 2021, is just as challenged as it was late last spring and early summer, where people aren't answering the phone, people aren't providing thorough answers. And without that information, we can't target, businesses or establishments or events that may have, led to a disease surge.
Tom Durian with TMJ4 has a follow-up question for Mayor Barrett. On the corporate sites, who provides the vaccines? Is Northwestern Mutual picking up the cost of facilitating the vaccinations?
It's my understanding that they're working with us to get the vaccination, so we will provide them with the vaccination, but they're providing cost for running the sites. If we're wrong, we'll correct that, but that's my understanding.
Thank you. Jason Calvi has a follow-up question. Jason Calvi with Fox 6 has a follow-up question for Dr. Weston. What is your reaction to the neighboring county of Waukesha getting rid of capacity limits? How do you think it could impact Milwaukee County?
So I think certainly each county has to figure out what their own priorities are. I would say in Milwaukee County, I think there's been an outstanding partnership with really putting health as the top priority. And in that case, I'm not sure how Waukesha will affect Milwaukee necessarily, but I think within Milwaukee, we're doing our best to limit the pandemic, provide the proper messaging, and get people vaccinated as quickly as we possibly can.
And our final question is from Joyce Garbasiak with WISN 12. She says, a poll by the Pfizer Family Foundation has found that 52% of frontline healthcare workers have received the vaccine, meaning more than 4 in 10 have not been vaccinated. How can the public have confidence in the vaccine when those most closely impacted are choosing not to be vaccinated?
So I'm not familiar with that poll. I would say that I think in Milwaukee County, the vast majority of healthcare providers, specifically, I think the healthcare providers that see the negative effects of COVID up close, those who work in emergency departments, those who work in intensive care units, jumped at the chance to be vaccinated. And we hear over and over from our healthcare providers from all different parts of the community, from all different specialties, all different health systems, talking about the high level of efficacy and the high level of safety in each of these vaccines. So I think listen to your community, ask other people who've been vaccinated about their experiences. If you've been vaccinated, share your experience, share your story with others, and talk to your healthcare provider and ask them what their opinion is of the vaccine.
Thank you. That is our final question in the chat. So that will conclude today's briefing. We appreciate everyone's time. Thank you, Bishop Burt, for joining us today, and have a nice weekend, everyone.
Thanks, everyone.
Thank you.
Take care.